Hi, I'm Dr. Bojana Jankovic Weatherly, and I'm a board-certified internal medicine and integrative medicine physician. I'm going to start by asking you a few questions. How many of you are worried that exposure to environmental toxins can cause chronic disease? Please raise your hand. And how many of you think that stress can impact your health? Please raise your hand. And how many of you feel overwhelmed with all the information about how to live your best, healthiest life? Please raise your hand. Well, you're in the right place. I'm going to share with you the steps that you need to know to live your healthiest life. But first, I'm going to make a confession. I was also overwhelmed by all this information about 5 years ago when I truly realized the burden that toxins have on our bodies and our health. When I was introduced to the Environmental Working Group, I realized that we're swimming upstream in this river of toxins that we know very little about and that we're not protected from. And that was very concerning for me. But as an integrative, internal, and functional medicine physician, I learned that we have the power and we do have the tools to overcome this burden and to prevent many chronic diseases that are caused by diet and toxins. Now, let me talk about a particular type of toxin that I was exposed to during my residency training. It's called stress. Yes, stress is a toxin. I was pregnant twice during my internal medicine residency training. My OBGYN said, look, there's never a good time to do it. It's like the Nike slogan, just do it. So I did it. I had my babies during residency. And so in the midst of 30+ hour shifts, working 6 days a week, being on call every 3 to 4 nights, I figured out how to keep myself hydrated and nourished by keeping a water bottle in the pocket of my white coat and sneaking in some almonds and an apple in the nurse's room or the bathroom. But what I didn't escape from is the exhaustion and burnout of being in a demanding residency, taking care of very sick patients, and also taking care of my baby during pregnancy. On top of that, I found out that my baby was measuring very large. In fact, both of my babies were large. One was over 10 pounds. And my OBGYN said, look, we've got to talk about the possibility of C-section. Well, this was my critical point. I woke up in the middle of the night one night, totally desperate and sobbing. And being the science nerd that I am, I started a PubMed search to see what kind of implications this exhaustion and long hours and night shifts had on my pregnancy, and could they possibly cause any complications in my pregnancy and labor? And yeah, there was plenty of research. In that moment, instead of being reactive, I was proactive about my health. I decided to make a commitment to myself and my daughter Olivia that I'm gonna do everything in my power to have the healthiest pregnancy possible, to really take care of our bodies. So I turned to integrative medicine modalities. I started doing prenatal yoga. I started working with a birth doula. I started doing acupuncture and chiropractic to prepare my body for the birth of this large baby. And as I was doing this, my whole perspective on medicine shifted, on how we can truly support our bodies and our minds to heal, how we can support them to be at the highest level of health. And as a result, I had 2 healthy pregnancies and 2 healthy babies. So 2 years later, when I started practicing as a primary care physician, I was seeing a lot of patients that had chronic symptoms, whether it was irritable bowel syndrome, whether it was autoimmune disease and thyroid problems, stress, anxiety, depression. Many of them suffered for a long time. And instead of throwing more medications, I decided to get curious, to take a step back. I decided to find a way to empower my patients the way that I was empowered by my health practitioners during my pregnancy. And I found that by working with my patients on improving their nutrition, improving their healthy lifestyle habits, reducing their toxic burden, they actually got better. We actually started addressing some root causes of their chronic symptoms. And I was able to take many of my patients off of medications. And when I think about nutrition and working with my patients on improving their nutrition habits, I always think of some of my fondest memories of growing up in Serbia. I remember going with my grandmother to a piazza, which is a word in Serbian for the farmer's market. I remember villagers from the surrounding villages coming into my city and so proudly showcasing their fruits and vegetables. I remember those beautiful, vibrant colors and the smells of strawberries, tomatoes. I remember biting into juicy peaches. I remember this clean, whole food. Fast forward, 10 years later, in the mid-90s, I immigrated with my family to North America. I remember my first encounter with a large supermarket. There seemed to be an abundance of everything, all sorts of packaged products and colors. And I remember also looking at the ingredient lists and finding dozens of ingredients with names that I couldn't pronounce. And it's not because English was my second language. And what I later learned is that many of these ingredients are toxins. Let's, for example, take glyphosate. Glyphosate is a commonly used weed killer. It's used in genetically modified corn and soy, and it's also used as a drying agent for oats. Well, glyphosate has been classified as a probable carcinogen by the World Health Organization's International Agency for Cancer Research. A probable carcinogen in our breakfast cereals, in our snack bars? What? We're consuming this stuff every single day. And there have been many studies that have shown a correlation between glyphosate and non-Hodgkin's lymphoma. I remember a patient during my residency training who was hospitalized for months and on chemotherapy for non-Hodgkin's lymphoma. It was a young man. I remember every single day his body getting weaker and weaker. Until one day, it gave up. I can't help but think whether glyphosate or other pesticide exposure contributed to this cancer. I can't help but think of the implications of toxins, whether they're pesticides, whether they're plastics like BPA or phthalates that are in our food packaging and toys even, and our cosmetics, and the implications that they have for our children, for ourselves, for our reproductive system, for our bodies. But what I want to tell you today is that every single one of us here has a choice. We all have a choice to work to reduce this toxic burden. Whether it's the toxic burden from stress, whether it's the burden from these environmental exposures, and from our diet. We all can follow these steps. Eat whole foods, organic, reduce your toxic exposures, master stress, implement gradual changes to improve your lifestyle, and work with a qualified healthcare provider. And if you're interested in working with me, I'd be more than happy to have a conversation. You can reach me at drbojana.com. That's drbojana.com. Thank you.